His topic actually is quite controversial, and it's one presentation I'm looking forward to maybe debating or discussing. He's going to discuss the introduction of a training program for radiologist assistant, and you probably all know that there's been a lot of talk about recently. I believe future of radiology would see a lot of those coming, so we might just as well hear Dr. Jason's take on this. Dr. Jason, welcome in Egypt, welcome to the stage. Thank you.
Okay. Yes, good morning. My name is Jason. I'm actually from Baltimore, Maryland in the United States. And first of all, just a little bit about myself. I'm a radiologist assistant, been practicing since 2005. But overall, I'm an x-ray tech by trade. I've been practicing since 97. For some of those who may not know what a radiologist assistant is, I was just going to describe that a little bit more in detail. We are actually physician extenders to the radiologists, specifically to the radiology department. We're involved in doing procedures, freeing up the radiologists to actually perform those critical reads. And I also consider myself an instructor, actually an educator, because I'm a key component in the training of residents and fellows and occasionally new radiologists that come into our facility. So right here before we start, this is actually Johns Hopkins. This is the dome, which is located outside. For individuals that ever come to Johns Hopkins, generally everybody's taking pictures of the dome. So this is the popular dome right out front. Go ahead and get started here. So this actually started off as a project in which I'm trying to initiate at my facility, and hopefully we could branch on internationally, specifically with radiologist assistants. Again, I'll go ahead and describe the RA again. Radiologist assistants are mid-level providers that perform as physician extenders, specifically within the radiology department. As an RA student intern, I learned how to perform procedures by reading the recommended books and by implementing those techniques on patients in the hospital environment. Currently, there are 6 recognized RA educational programs throughout the United States, with over 650 of us actually practicing currently. The background: all radiologist assistants have undergone training specific to their educational program and how they were trained at their respective institutions. So this can actually vary depending on the radiologist protocol or what the facility wants. The problem is that newly hired RAs, specifically at our institution, since I started specifically at Hopkins, I've hired 2 more, one for outpatient and one for adult setting. I specifically work in pediatrics. I'm trying to streamline the process of performing protocols from A to Z. So all RAs are trained differently, and they all do protocols differently. So this could be secondary to how they were initially trained at other institutions or how competent they are at performing procedures. The goal was to utilize an outpatient fluoro room as new simulation lab. The simulation lab will have fluoro capability, PACS workstations, ultrasound equipment, and equipment to practice examinations and protocols. This will offer a comfortable environment for radiologist assistants to use high fidelity and low fidelity equipment to practice examination protocols or mannequins and phantoms. First of all, I did a survey. I wanted to see who thought would be interested, so I actually surveyed my colleagues. Published a survey through 3 Facebook community pages, and unfortunately, I had 63 respondents out of 650. 59 respondents consider themselves as an experienced RA, while the remaining 4 were not currently working as an RA. A total of 57 respondents stated they did not attend a program that offered high fidelity or low fidelity equipment, but overall they were interested. Here's the results of the survey. The survey showed that one question: did you feel comfortable performing procedures without initial experience? 63% said they were not comfortable. Next question: would you consider it beneficial to gain experience in a high fidelity or low fidelity simulation training environment? 85% considered it beneficial. They wanted to have the experience, they want to be comfortable doing procedures before they actually touched a patient. Next question: if you had an opportunity to practice procedures in a high fidelity or low fidelity simulation training environment, would you take advantage of that? 95% said yes. One more question: do you think practicing high fidelity or low fidelity simulation training equipment can help streamline the overall process of performing a procedure? Overwhelmingly, 98% agreeing streamlining performance. Do you believe high fidelity or low fidelity training can improve overall clinical performance? 97 also agree it would be a good improvement. So the benefits of a simulation suite. Outpatient floor department that we have is large enough to accommodate multiple trainees. It's readily available 24/7, 365 days a year. The new simulation suite can be used by us REs for training, as well as interns, residents, fellows, technologists, as well as other RT students. We have 2 available ultrasound machines that can use within a component of the floor lab. I'm taking the lead of the project. The new simulation lab will be a great resource in training our radiology staff within various radiology modalities. And simulation experience and open discussion regarding protocol performance can help streamline examination without any variation. Sorry, I'm going to skip through here. This is the outpatient floor suite. These are some of the rooms that we have. These are some of the phantoms that we actually use and practice with. Additional phantoms for biopsies. Examples of simulation: fluoro procedures, minor interventional procedures, ultrasound procedures. Advantages: allows clinical professionals to train in a virtual environment, phantoms as well as models, decreases the lack of uniformity amongst trainees, increases patient safety throughout practice, decreases radiation exposure through practice protocols, cases can be reviewed, and allows time for a debriefing at the very end. Conclusion: this will be following up here and we're done. Instituting a simulation suite at our academic institution is an excellent resource to assist in teaching and learning practical experience of procedures in a safe, simulated clinical environment. Although the performance of procedures on mannequins is not the same as examining a real-life patient, the performance of procedures on high-fidelity and low-fidelity equipment while utilizing phantoms and their components have been documented as an ideal way of educating the healthcare provider. Understanding the process and the act of obtaining experience in the simulation suite offers the track of learning procedures without the concern of. Okay, perfect. Thank you. Also, experiences gained through simulation and active repetition increases self-insurance and clinical performance. Future way I look at it is there's an increase in uses of simulation training throughout academic institutions. I know the best way to learn is doing it on a real-life patient yourself. That was the best way I learned. We didn't have a simulation environment, but knowing how potentially, you can work with a phantom, you can do maybe like a shoulder arthrogram on a phantom beforehand, you can simulate with a mannequin and look at corresponding case studies that have been saved. You can discuss what imaging, what protocol, and what pathology you're looking at. It's a great way to educate the provider before they actually go touch the patient themselves. Thank you for your time.
Thank you. Thank you very much. And I'm sure there'll be a few questions for you coming up.